Okay, good afternoon, everyone. I'm Jessin Joy, Program Coordinator of the OBA program at Lead College, Sydney. And I am here to discuss everything about OSCE, Objective Structured Clinical Examination, which is basically the second examination about in the OBA process for the overseas registered nurses. If you have been following up our various events that we have been doing on the Lead College Facebook page and our other social media platforms, you know that we have been very active in terms of providing all the information to our overseas registered nurses about NCLEX, OSCE, how to apply for registration and everything. So AHPRA, Australian Health Practitioner Regulation Agency, has published a handbook for NCLEX examination as well as for OSCE examination. And as many of the overseas registered nurses have taken their examination already in Australia, NCLEX examination, everybody was waiting for the OSCE examination to begin. So here is the good news, everyone. On 14th and 15th December, the first OSCE examination, the first examination for Adelaide Health Simulation Lab for overseas registered nurses has been launched. And the students have already been notified that they can book their examination, and they can travel to Adelaide for the examination on 14th and 15th December. And today we have Lillian with us. Lillian is our lecturer for our OSCE program. And Lillian has given us some few minutes from her busy schedule training our students who have started their OSCE program on Monday, last Monday, 16th. And these students will be basically going and appearing for the examination soon. So I have the privilege to introduce Lillian with me. And basically we thought that we will basically kind of do a Q&A and simplify the AHPRA handbook for OSCE for our viewers. And as many of you don't have the time to go through the handbook in detail, or went through it but still has a lot of questions, you can type those questions in the comment section and we'll be happy to have you answer those questions as well. So Lillian, welcome to you. Your first Facebook Live, I believe, Lillian.
Yes, it is. Hello, everybody.
Okay, Lillian, thank you so much, Lillian, for joining. And Lillian, the first thing that I would like to know from you is, can you give us a brief overview about the OSCE examination?
Okay, as you've heard from Jessin, OSCE stands for Objective Structured Clinical Examination. This is a practical examination that is required for all internationally qualified registered nurses who wish to seek registration in Australia. So with this examination, as per the information that we have received from AHPRA, AHPRA stands for the Australian Health Practitioners Regulatory Agency. This agency is responsible for our registration, meaning the license to practice. So from the information that we have received from AHPRA, and what they say to us is that it is not a limited list, but the skills that will be assessed will be based on physical observations, vital signs, calculating drug dosages, injections, which may or may not include subcutaneous injection, intramuscular injection, as well as intravenous injection. Other things that may be assessed or may be the aseptic non-touch technique, hospital-based resuscitation, meaning basic life support with or without the automated external defibrillator. Other things would be the assessor will be checking and assessing that the student knows how to discard that the students will know how to discard their sharps in a safe manner. Medication administration will also be another subject that may be assessed. Wound care, hand hygiene, therapeutic communication with the patient as well as with the family, knowing how to get consent from the patient, infection control practices, and patient identification. Also, they may assess the student on risk management in the clinical environment. And of course, you will get a section where you will be assessed on drug administration, which may be oral, intravenous, or both. So in this exam, you will have 10 stations, or the other word is clinical scenario. In each station, you will be given 10 minutes, 2 minutes to read and to plan your scenario, and the remaining 8 minutes will be to execute your plan. At the end of the 10 minutes, you have to move to this next station until all 10 stations are completed. In this time, if you have not had the opportunity to complete your scenario fully, when the time is up, you have to move to the next station.
Thank you, Lillian. That was very valuable. I think you covered a lot of things. And Lillian, I see that from the AHPRA handbook, a lot of focus is on communication. So, can you tell a little bit about more? What is it that I think the students or the nurses are expected to do in terms of communication?
In communication, as healthcare providers, we tend to use a lot of jargon. So jargon may be understood by us, however, it may not be understood by the patients or their family members. Therefore, we have to learn to communicate in a manner where it can be understood by the patient and the carer or the family member. We involve the patient in the decision making. We communicate appropriately with the family, with the patient, and with our own healthcare colleagues. We also learn in our communication to actively listen to our patients as well as to the carer or to their family member.
Thank you, Lillian. Thank you. Of course, communication is an important and integral component for all the nursing care and healthcare delivery. And Lillian, the question is that whether in each of the stations, whether they will be real patients or only mannequins. What does APRA tell us about that?
From the information AHPRA has given us, it will be blended. Blended meaning that in some of the stations, you will have a simulated patient, meaning that it will be a real person. In some of the stations, it will be a mannequin. So it's combined.
Just to add to what Lillian said, I think, but even if the station has a mannequin, so but you still have to approach and deliver your nursing care just like the way you do to an actual human being, ensuring that you are doing the same type of communication. You are from your end, you're basically simulating completely the way that you will be dealing with an actual patient. So no excuse on that. And other things, Lillian, I think APRA has mentioned that in terms of dress code, they haven't specified any kind of dress code, but what I understand is that basically they have to wear something formal and comfortable, isn't it?
That's correct. So we advise or we suggest to everybody who are attending the exam to dress in pretty smartly dressed clothes, but be comfortable because you may be required to kneel down or bend over. So it's easier and more comfortable if you wear tailored pants, have comfortable covered up leather shoes, have clothes that are suitable, that is suitable for the work and presentable as a as a professional as well. So meaning we don't wear torn clothes, our clothes will be well pressed or ironed. We mustn't have holes in our clothes. We don't wear string tops to the exam or see-through clothes to the exam.
Lillian, coming back to the scenarios or the list that APRA has provided in terms of the procedures that APRA has suggested, do you think that anything else that the student need to prepare apart from that particular list?
There are quite a lot of things to learn, but they are expecting when the student is being assessed is the capability of the students to be able to perform in a safe manner as a first year newly qualified registered nurse.
Yeah, just adding to what I think Lillian said, that although they have put in 15 procedures list, but if you look at the heading, they said that it is not limited to, so there's no harm in going through a little more ahead. But of course, these will be the 15 procedures basically, which every nurse who's being assessed as an undergraduate nurse of an Australian standard should be knowing. So definitely you should be going through those mandatorily. And apart from that, other things that I would like to tell our viewers is that those who have received their confirmation email from AHPRA, please make sure that you are going through the email carefully, ensuring that whatever documents that they have suggested you to bring in terms of your identity proofs and other proofs you have, and you have kept it all safely for your examination day. Those who are traveling from various paths, make sure that you can travel safely and come back to your destination safely. Please look at the guideline that has been published by South Australian government and other states to make sure that your travel arrangements are all safe and sound. Apart from that, please ensure that you are maintaining the appropriate decorum for your examination, and you are practicing and you are following the code of ethics for nurses and NMBA standards of practice. You have gone through it carefully and your behavior is appropriate to the examination hall. Apart from that, I think what I would like to tell you is that I was just discussing with Lillian before that, I don't say that it is impossible for overseas registered nurses to clear the examination without any training. However, it's a difficult examination to clear, especially because you must be very, very experienced. All the nurses that we interact with, very, very highly qualified and experienced nurses in their home countries. The only gap is basically whether they know how to do things in an Australian way, or are they familiar with the equipments and instruments that we use in Australia. It may not be very, very varied, but yes, minor changes must be there. So I would suggest all those who are waiting for their OSCE examination to think of a preparation, a structured training program to meet your needs for your OSCE examination. Expensive examination, a lot of effort is required. So you should be definitely considering to do a training program that will assist you in and prepare you for the examination, the big day. Okay. And at Lead College, we offer a 4 weeks training program, very well structured. We provide you all the handouts and notes, and it's all about practice and practice. So practice till the time it becomes your second nature is what our goal is. And if you see the beautiful lab behind Lillian, and that is just one portion of our lab, equally big lab, equally big portion other hand, and we have all the facilities that you require for your examination. And very glad to tell you all that we have already started our OSCE program, and I believe you're the first training provider in Australia to start the OSCE training program on 16th of November. And we already have students practicing in the labs, and started with a very small group. And I'm sure that as we move ahead, it will be great for all of us. And just adding anything else, I think I have covered up everything. I think one or two questions more what I generally get is that can the students repeat their OSCE after, if in case they unfortunately fail? So yes, they can repeat the examination. They will get a notification from AHPRA about the further steps on how to rebook their OSCE examination. And other thing that the student asks is that how many times can I appear for OSCE in a year? So that information is not available from AHPRA yet. So hopefully in the near future, whenever we come to know that the number of attempts allowed for each student, we will definitely let our viewers know. Apart from that, we are starting our second batch of OSCE on 4th of January, just after the first Monday of the new year 2021. And we are happy to take all your queries and questions about that batch, as well as our next batch in December for NCLEX, 7th December. And if you have any questions about these two programs, NCLEX and OSCE, you may please get in touch with us on oba@leadcollege.edu.au. And you may ring us up. Our contact numbers are there on all our advertisements, and we will be happy to answer all your questions. Just quickly checking if there are any questions, please type in the questions in the comment section, or if you don't have any questions, you can type in them and we can respond to you later. So thank you, Lillian, for your valuable time. And I know that your students are waiting, and thank you for spending a few moments with us and imparting the vast knowledge that you have in terms of your OSCE. Thank you, everyone. Thank you, all of you.
Thank you.